Hello, back again with another episode of Real Health Talk with Dr. Coring. My name is Dr. Coring. I am a board certified internal medicine physician as well as a fellow who's training right now in the field of hematology and oncology. Coming at you with another episode of Real Health Talk with Dr. Coring, exercising my passion to educate patients and common folks such as yourself regarding wellness. And I like to do episodes via podcast to educate people such as yourself regarding various health topics. And today, this episode is for our sickle cell population. So if you or a loved one, or if you know a loved one who have sickle cell anemia, this episode is likely for you. And today I want to discuss some news regarding a medication that's designed to help patients with sickle cell anemia. This medication is called Oxbryta, and that's the generic name. The brand name is voxelotor. And this is a medication that was manufactured by Pfizer and approved by the FDA for patients with sickle cell anemia to essentially help prevent pain crises. And so this medication was approved in 2019 by the FDA and also distributed and granted approval in more than 35 countries throughout the globe, globally, for patients with sickle cell anemia age 4 years old and greater. So for kids and adults with sickle cell anemia, and this was a tablet that was designed to take on a daily basis to help prevent pain crisis. However, as of September 25th of this year, at 5 p.m., Pfizer issued a notice. And the notice essentially was a voluntary recall for the medication. Basically, Pfizer voluntarily withdrew all lots of sickle cell disease treatment, Oxbryta, generic name, and the brand name voxelotor. Actually, Oxbryta is the brand name, and the generic name is voxelotor, from worldwide markets. And so what happened? So they announced on September 25, 2024, that they're voluntarily withdrawing all lots of Oxbryta for the treatment of sickle cell disease at this time in all markets that were approved. And they discontinuing all active voxelotor clinical trials and expanded access programs. Okay, and so that's part of it, that's part of the statement. And I'm not going to read everything and all of it, but I use part of the statement to basically as a foundation point or a launching point for this episode. And so what I want to get into this episode is two things. One, I want to warn you guys and inform you guys or anybody who's taking this medication or who had this medication in their possession to stop taking it if you have sickle cell anemia. All right, so that's one. And two, I want to allow you to understand why. Why have Pfizer issued this statement? Why did the chief medical safety officer decide that this was necessary? Okay, so one is the warning. If you are a patient, you need to ask your physician, your pharmacist, or any healthcare provider, whomever prescribed you this medication. You should contact that provider to discuss this. But as of now, Pfizer is recommending that you stop this medication, all right? So that's the goal. That's one goal. The second goal, we need to talk about why, all right? Why did they issue out this warning, and why are they recalling and not manufacturing any more of this medication? It's simple. Safety. All right. I respect Pfizer for basically trying to keep our patients safe. I respect them for understanding that this medication is causing issues. All right. And I respect them for standing on those issues and standing on the fact that they want to protect our sickle cell anemia patients by, recalling these medications. They lose a lot of money doing this. So, in fact, it shows that it shows a sign that they actually care about the patient population that this drug is affecting. So that's what's up. I respect that. All right. And they made a statement saying that their primary concern is for the patients who suffer from sickle cell anemia. And, they remain very concerned about this patient population, so much so that they're recalling a medication that adversely affects them or our patients with sickle cell anemia in the wrong way. Essentially, when we prescribe drugs as prescribers and practitioners, we prescribe them with the notion that this drug will help the patient. However, if the drug is not helping the patient, in fact, if the drug is making the patient condition worse, then there goes the drug. Essentially, as a prescriber, we say, nope, the drug is not working. In fact, it's harmful for you. And so we don't no longer use that drug and actually prescribe something else. So our first worry is, or our first thing that we ask ourselves when we prescribing drugs or medications to patients is it going to help you? And if it's going to help you more than it's going to hurt you, then it may be a good idea. But if it's going to hurt you more than it's going to help you, then it's not a good idea to take it. All right. So let's talk about why this drug was designed. What was its intent? All right. So the intent was to allow the red blood cells or the hemoglobin to have more of an attraction for the oxygen molecule. So with sickle cell anemia, one of the problems is the red blood cell itself basically will have an abnormal shape. And because of that abnormal shape, the red blood cell will not have such an attraction to oxygen. And once the red blood cell does not have such an attraction or an affinity to oxygen, people experience something called ischemia, which causes pain. And that what essentially drives or causes the pain crises. So this drug was designed to actually help or allow the red blood cell or the hemoglobin to actually have this attraction to the oxygen. And the idea was to have the attraction to the oxygen molecule, which would in turn reduce the pain crises. Well, it turns out that people or patients who were prescribed this medication, they were actually having more pain crises, more visits to the emergency room because of pain crises. And you may be a patient, your hematologist may have realized this and told you to stop taking the medication well before Pfizer issued this warning and this voluntary withdrawal of the medication. So that's good. But if you are one of those patients who were still taking this medication, and maybe you have noticed you having more pain crises and more trips to the emergency room because of these pain crises since you started this medication, then this is probably why. This could be very well the reason why this have been occurring. And so therefore, it is very prudent. It's very important that you stop taking the medication because Pfizer has basically said that this medication has been known, based on their information and their data gathering, that it's been known to make matters worse as far as pain crises are concerned for sickle cell patients. And so therefore, if you know a loved one who have been prescribed this medication, it's advised by the manufacturer, which is Pfizer, to stop taking the medication. And so I advise you to talk to your provider, whomever prescribed you the medication, to make sure that it's okay that you stop taking the medication. But according to this notification that was issued on September 25th this year, 2024, it's been advised that this medication is more harmful than benefit to our sickle cell anemia patient population, and it's advised that you stop taking the medication. All right? And so if you need more information, Pfizer is recommending that you contact your healthcare provider, and or you could contact the company themselves, 1-800-438-1985. And so therefore right now, as of today, this is the recommendation. Now things may change. I'm not sure. But my goals right here, right now, two goals, and I hope I accomplished the goals. One, to warn you about this, and two, to let you know why. So the warning, hey, if you do have sickle cell anemia and is taking this medication called Oxbryta, you should stop taking the medication and contact your provider as soon as possible, because the reason why, and this is the second goal, is the reason why the manufacturer, Pfizer, issued this warning and now voluntarily withdrawing these medications from the market, and also not from only in the United States, but in 35 other countries, is because this medication has been understood and now known to cause more pain crises and not preventing the pain crises from happening in the first place, which that's what its intent was to do. And so therefore, the risk and the harms outweigh the benefits of the drug. And that leads to a voluntarily drug recall. And so that's why the manufacturer decided to withdraw right now the drug from the market as of now. All right, guys, this is my time. That is my time. I love you guys. And like and subscribe. Like and subscribe. I really would appreciate that. Leave some comments so I can understand things that you guys may be interested in. And that would help me in the future to continue to come up with topics and to talk about things that are pertinent to you guys. All right. And so that's my time. Peace.